Welcome back to MadeToBeWhole. This week we have a special guest, Michelle, a parent of an 18-year-old who has dealt for years with Bartonella, PANDAS, and was recently diagnosed and treated for compression syndromes. Stay tuned.
MadeToBeWhole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on MadeToBeWhole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing.
So this week we have Michelle, who I'm really excited is here. Her son, Carson, is a patient of mine, and full disclosure, Carson has given consent for this conversation to happen. Welcome, Michelle.
Hi, Krista. Thanks for having me on the show.
Thank you for being brave enough to come and sharing your story. And one of the reasons I really wanted you to come is because it's not just a story, it's a journey. And it's a journey that started a very, very long time ago. Carson is 18 now, right?
He just turned 19.
Just turned 19. Okay, so 19 years old. So when did you first notice something was different with Carson's health?
Well, about Carson, when Carson was born, he was in the NICU, and now looking back, I know a lot more. So I've made some thanks to you, your help, and just the doctors that we are currently seeing. We connected some dots. He was in the NICU, and I was nursing, but of course your breast milk isn't in. His formula wasn't being digested. And they said, oh, sometimes that happens, no big deal. We'll just try different formulas. And so brought him home, and, I was nursing. So we got all of that straightened out. But then he got acid reflux. And so a month in to this new baby that I had that had some lung issues because of being premature, he has to go on medicine for acid reflux. And we stayed on, I was so resistant. I changed everything in my diet. I was like, maybe it's me. He's getting this, because he's nursing. And the doctor kept saying, no, we need to treat him because he would arch his back and he'd projectile vomit and all of these things. And so I was like, okay, finally caved and gave him the medicine. Well, he stayed on the medicine till he was about 18 months old, and then we took him off the medicine. And he seemed to be better. And then during this time, he developed all these allergies, and he had asthma. And at 2 years old, he had an anaphylactic reaction to tree nuts. We had given him peanut butter. He was fine with it. He would have like sensitivities, like he would break out in a rash from certain things. And so we always were watching and just keeping an eye on all of that. Well, then the allergies came asthma and chronic like croup infections and things like that. So here's supposed to be these fun years of having a baby. And I was constantly like bringing him to the doctor, and this is wrong. And, what's happening. And with the asthma, we noticed he had sleep apnea. So 2.5 years old, he had his tonsils and his adenoids removed. And all of a sudden now we started on all of these medications for asthma and allergies. The acid reflux seemed to subside, but in its place came constipation. So Carson was amazing. He was amazing. Even through all of this, he was always really an easy, good baby, an easy, good little boy, like no problems. People would be like, oh my gosh, how is he such a good kid? And he didn't ever really complain about a lot of things. It was just what it was. But I noticed as a mom, he potty trained himself, literally. He just decided one day he didn't want to wear diapers anymore. So at 2.5, here's this kid who just had his tonsils and his adenoids removed, deciding he's not going to wear diapers. So
That's awesome.
it was amazing. People were like, how is this happening, Michelle, that you have this baby that's like this? So fine urinating. But when it came to bowel movements, it was days that he would be constipated or he would not be going. And so I mentioned it to his pediatrician, who was wonderful at the time, very forward, always, if he wasn't sure, he always was proactive versus reactive. And he would say, like, that's out of my wheelhouse a little bit. Let's see, with the allergies and the asthma and stuff, he directed us. Thought we were at the right spots with all of that. He directed us to a doctor in Pittsburgh, a gastroenterologist. So first steps were, the doctor said, oh, he has so many allergies and stuff. Maybe his diet is not fiber, like nutritious. But I was giving him prunes. I was giving him prune juice. I was doing all of the things that naturally I could. And then still not having any success. He would sit. We joked about it because we had multiple things that we would sit on the floor while he was on the toilet, trying to go for 45 minutes. Mm-hmm. So when we saw the specialist in Pittsburgh, he said, this is very common with little boys. They don't like to sit to go to the bathroom. And I was like, well, wait a minute. We're sitting for like 45 minutes. He's like, yeah. And so, hearing that, I was like, okay, this just doesn't make sense. And had his first endoscopy. He thought it was, I can't even remember he tied in the acid reflux, which really we weren't seeing that part anymore, but he's like, I think it's going to be this. And when he did the endoscopy, he told us at that point that everything was okay. He needs Miralax. So I was like, oh, he's like, you've tried all the other things. I mean, I gave him pear juice, prunes. I can't even tell you. Mm-hmm. I was looking up like almost what could make him have diarrhea, right. How do we reverse this? So endoscopy comes back. We're seeing this specialist in Pittsburgh and doing the Miralax. So Miralax was good, started to help a little bit. So we were like, okay, every time we would wean the Miralax, the constipation would start again. The sitting would start again. Then even with the Miralax. So they were like, well, it's psychological. He just doesn't want to go. So here we are as parents who are like, okay, let's listen to the specialists, right? They're telling us this is what's wrong. At the same time, Carson he was open to eating everything when he was little. Everything. I mean, people would be like, I don't know how you get him. He's eating, giant Italian olives. And there was nothing that he didn't like except for eggs, which through his allergy panel, we found out he was allergic to. So, that made sense to me. He avoided them. And that's what the allergist said. He's not eating those things, Michelle, because kids have they have an intuition. And so he's staying away. And as he's getting older, he's determining. I was like, okay. But his diet got smaller and smaller and smaller. And so he would eat certain things, only those things, only certain ways. He never was a big eater. He was born, he was 23.5 inches long, 9'1". I had polyhydramnios, too much fluid. So he was in the NICU at 9'1", looking like he ate the other babies, right? Because there's these tiny 2-pound babies and here's Carson. And so, I was like, okay. But he was always always in the 99th percentile for height, 25th percentile for weight. So tall and skinny, like his dad. My husband's tall and thin. So that was like, they always attributed it to that. Like, he's just a tall, skinny kid. He's always going to be thin. Don't worry, kids eat when they're hungry. You don't have to worry about that. But I noticed, like, all right, his friends are voracious eaters. Carson is minimal and picky. And people were like, oh, sometimes kids, when they get that autonomy they're developing, they decide they'll eat when they want. It's just all of the things that you could be told, right?
Mm-hmm.
And I'm like, okay. So we struggled for the allergies, the asthma stuff. We worked diligently, like we got rid of all of our carpeting, because he was on inhalers and he was on allergy meds. And I was like, he's 5 years old and we're
Right.
doing all of these things. So, filters on our furnace, all of the stuff that we could do. Then that you live in that, right? So you think
Right.
it kind of becomes your normal. The eating was what it was. The Miralax was
Part of life.
rotational,
Right.
right? We would try, we would skip, we would start again. Then when Carson, we went to, I forgot about this. When he was 6 months old, he was not really wanting to sit up. Because he was in the NICU, our doctor, who was wonderful, very progressive in thinking, said, you know what? He's great in every other way. Let's have him just tested. We want to test his motor skills. So we did that. He tested just borderline for gross motor skills. And they said, let's do early intervention. Never a problem to doing early intervention. You qualify because he was premature. We'll make sure, and then he's going to be on track. So the therapist came to do early intervention, and she said to us, oh my goodness, he's like gymnast flexibility. And she took his legs, and I will never forget, she like separated them and they went to the sides easily, and she's like, do you see this? This is not, people strive years and years and years to have this flexibility. Never saying to us, this is concerning,
Right.
that he's so flexible. So first goal was to get him to sit up. Took time, but we got him to sit up. Second goal was, he was sitting up, he really could give less about crawling. And she said, well, Michelle, a lot of times babies, they don't need to. He's an only child. You're doing everything. I was like, okay. So all of this was the progression.
Right.
He finally was walking. He talked. Carson talked when he was, I don't even know, 7 months old. He started saying little words. By 9 months old, he was talking. By a year old, he was really talking. So they had to test him for everything, to get him out of the early intervention program. He tested at 18 months old, at 3 years old. Always super bright. People would say like, oh my gosh, Michelle. And, my husband and I, both in education, we thought it's just because, he's the child, he's the only child. We're just talking at home to him like he's an adult. That's why he's like this. He knew, colors. He was always super bright, right? So now looking back alongside of all of this, right? Here's this kid who was really intelligent. He was struggling with the asthma and the allergies and stuff, but he was also like quieter and not a complainer. And, so he did his work at school. There was nothing that was like a red flag for anything. He just was not a great eater. He had allergies and asthma and, okay, so we're dealing with all of that. When he was no, 8.5 or 9, the dentist said, I want you to go have an evaluation for braces. He was born with these perfect teeth. They said they call it a Hollywood smile. And then his teeth started falling out and his adult teeth started coming in and there was no room. That happened to me when I was little. So I knew the process, right? We went to the orthodontist and the orthodontist said, oh my goodness, he has so many, like, there's so much crowding. His mouth is, it's not big enough. So we went to see the oral surgeon and had some baby teeth extracted, hoping that that was going to give enough room for the next set of teeth. Didn't. Followed a year later, the other teeth are trying to come in. So the dentist, the oral surgeon looked at him and said, we have to extract some adult teeth because he's never going to have enough room. So we're like, okay. So we went. Carson was kind of not feeling good, but he had seen the oral surgeon. He'd done surgery before, rebounded like instantly. No problem. Put him under, actually tomorrow, well, it would be today that we went to see him 9 years ago. Tomorrow, 9 years ago, he had the teeth pulled, came home that day, was not the same kid. Like just didn't feel good, got, like it was a totally different experience from the teeth being extracted the first time. And all I could think of is, well, these were adult teeth, a little more invasive, that's probably why. So, went to sleep that night. And my husband and I started wrapping Christmas presents. And Carson, he didn't want to eat the whole day. He just, was not feeling great, whatever. So not anything that was alarming other than that, why isn't he rebounding the same way that he did before? Probably about 45 minutes after he went to sleep, the screaming that happened from his room was like nothing I had ever heard from Carson before, ever. I'm not going to get emotional on this.
You can.
I went in his room. He was drenched head to toe, like somebody had doused him with water. He was soaked. His bed was soaked. The screaming was continuing. I was like, Carson, I'm here. He was like screaming that he needed his mom. And I'm like, I'm right here. I'm right here. He was having a night terror. Or I didn't know that at the time, right? I thought, like, what is going on? Checked him immediately for a temperature. He didn't have a fever. He was like, it took us, my husband, Monty was there with me, took us like, I don't even know how long to just even calm him. Changed his sheets, changed him. Like there was no fever, there was nothing. I stayed with him for a little while, went back to sleep, happened 3 more times that night. In the morning, he woke up. I called the doctor right away. The oral surgeon was not in the office that day. Didn't have a fever, didn't have anything. I said, could it have been, no, he had anesthesia from when he had his adenoids out, tonsils and adenoids from the other time when he had his teeth extracted. I said, could it have been the anesthesia? Is there something? I said, I don't think, Michelle, I don't. Let's see how he does today. So during the day, he didn't want me to leave his side. He was just not, I attributed it to like, okay, he's sick. He doesn't feel well, whatever. He didn't eat anything yesterday. He ate minimally that day. He's like, don't worry about him eating, just give him liquids and stuff. So that night he goes to bed. worse, happened worse. I stayed with him in his bed, slept right next to him. On the next morning when he woke up, half of his bottom lip was chewed off. All of his fingernails. I was like, I was in bed with him, right? I slept right next to him. He had peeled all of his fingernails off. Like they were gone. And I was like, I was right here. How did this even happen? He had these terrors so bad. He thought he was trying to get out of our house. He woke up and I had to literally like hold him because he was trying to open the front door and run outside. I called the doctor and I said, something is really wrong. Please, please, can you see my son? I called our pediatrician. Our wonderful pediatrician left. There was a new pediatrician there. She said, you need to call the oral surgeon. Start there. Something they did, we hadn't done anything to him. You need to start with the oral surgeon. Our oral surgeon was off that day. We saw another doctor who was the biggest idiot I have ever met. Told me it had nothing to do with the oral surgery. He didn't see anything. I mean, as Carson's lip is literally like the blood. It was so, I wish I had pictures to,
Yeah.
pictures, but I was just like telling people doesn't give it enough. Like when I saw it, I was just like, oh, how is this even possible? And so the oral surgeon that was covering for the other doctor said, there's nothing, we didn't do anything wrong. And so we went to the pediatrician, did stuff there and testing and stuff. And they said he had strep and scarlet fever. He had a rash all on the inside of his mouth, which the oral surgeon never mentioned, all of that. So the strep and scarlet fever, we treated that. He went on antibiotics. He, did the course, got worse. And got that 2 months of our life. I need days to explain the horrors of the 2 months of our lives, hours of meltdowns, a kid that I had like in front of me that was a child I didn't even recognize. He wouldn't eat anything. He lost 10 pounds in a week. He couldn't even get off the couch.
And he was skinny to begin with.
Oh gosh, always skinny, right?
And I think for parents to know too, even though it's not always quite this, but with PANDAS, you've got that sudden onset. Like if you can tell me the day your life changed,
I can tell you
a red flag. Yeah. And also that the separation anxiety piece of it too, for people to know, like a kid who's not normally being clingy.
He wouldn't even let us open the door. Yeah. When Carson was little, like he was my only child. So I was that mom that, people are like, well, she's probably more smothering. That's why, he's not eating. He can get his way. Carson was this kid that was like, all right, mom, bye. See ya. Right. Like he didn't have that about him.
He was independent. Yeah.
He was independent. He was confident. He was bright. He knew how to multiply in first grade. Here he's going to school. This is fourth grade now, and he's going to school. And I was at the same school. His math teacher came to me and said, Michelle, what is going on? Yeah. He failed 4 math tests, 4 things in a row. He was his highest student. He wouldn't be able to write. Like he couldn't write anything. We had never heard of PANDAS, never.
Right.
Went back to the doctor. So we saw the PA who had known Carson from birth.
Right.
She said, Michelle, have you ever heard of this? He literally checked every single box. I was like, oh my gosh. Call back. Now the pediatrician they did some testing and the pediatrician, his titers were super high. She's like, that's because he just had strep. And no, they were very opposed, very averse PANDAS 9 years ago was like telling somebody, like talking in a foreign tongue. I mean,
Sure.
they had no understanding. They had no acceptance.
Well, no willingness to look. I think that's my biggest frustration. None of us know everything, but are you willing to learn new things and to blame the parent, blame the kid? You know, if you don't have the answer, it must be something's wrong with them, which you have no objective way of proving. You could
right.
just
Well, because I literally felt like my child was crazy.
Right.
Here, and so they said a couple things to me, like, you know, well, these are the times that kids develop psychiatric issues. And I was like, wait,
No, they're not. No.
overnight?
Right.
I
No.
put him to bed and then the next day he wakes up a different person. Like overnight that happened. And
well, and the deterioration in handwriting and schoolwork and all those things that were important to him too.
Right.
Yeah.
And Carson was that kid who was always really worried about his grades, right? He didn't need to worry about them because he was super smart, but he was that kid. Well, he couldn't even form a sentence.
Right.
He could not. So we finally, through other people, found a doctor in Cleveland who was treating the PANDAS, made some big changes in the beginning, right? He did antibiotics, a longer course of antibiotics. We've been through so many things. He was allergic to ibuprofen. So we did the, oh my gosh, what's it called? Where you do
the prednisone taper?
No, we worked with I can't think of what it's called.
It's okay.
It's with your body, so you hold the vials, and it's exposure. Oh my gosh, Krista, I will think of it.
Okay.
NEAT therapy.
Okay, sure.
Therapy.
Yeah.
Yes, that's what it is. So we did that. He was anaphylactic to ibuprofen, and she worked with us, worked with Carson. He went for months. It took months. And because ibuprofen is part of the protocol, when he went on the ibuprofen, finally, when he could do that, we saw an improvement, but never anything that was lasting. He went through 8 IVIGs. First IVIG seemed miraculous for 6 months. Then everything came back. So, okay, we probably have to do another one. We did that. And our doctor in Cleveland was wonderful. He was that doctor who was like trying to figure this out. That time he tested Carson for Lyme disease. He tested positive, then he tested him again, came back negative. And then, of course, now I know false positives, false negatives. Our testing is so flawed. We did all of that. He went through the IVIGs and he would be better for a little while and then they stopped. Like they just weren't working. So next on the docket for treatment is plasmapheresis. We went to Nationwide and had plasmapheresis. And during the time, it was ugly. I mean, like you could see the symptoms getting stronger. The issues with eating were like horrific. I understand because it stirred everything up in his body, right? I mean, that's what they told us. This is what's happening. Plasmapheresis for 5 days worked like a miracle. Carson was back. He had been a sophomore in high school. He was taking Latin. He came home. He did 7 Latin assignments in one day.
Wow.
I'm like, okay, he's back. He's good. He was eating. He wanted to eat. Lasted 5 days. At the end of the 5th day was like a plummet.
Oh.
We went then to Connecticut because I was a mad woman researching.
Your mom.
Yeah. And I kept saying to my husband, like, Moni, like something is wrong here. Why he has now still all the gastrointestinal issues, right? The not pooping, none of that. We went to see neurofeedback because I read about neurofeedback and I read about neurofeedback in PANDAS. So that's the doctor we were seeing first in Connecticut. When we saw her, she said, hold on a minute. Has he been tested for Lyme disease? I said, yes. Now, he had been tested 4 times at that time because his doctor in Cleveland kept saying, okay. But again,
Was it just the CDC regular lab test? Okay.
When we went to Connecticut, she said, we need to do some testing. She looked at Carson, and in between this tall, skinny kid who was never, ever overweight, never anything to have a fluctuation of any weight besides like a little bit of weight loss. You know, he didn't go from like, he lost 20 pounds or gained 20 pounds. There was never anything. He was always tall and skinny. He had these stretch marks horizontally across his back. One day he's changing his shirt and I was like, holy Carson, let me see your back. There's all of these stretch marks. And I was like, so, you know, I'm like, what is this from? Bring it up to the doctor, and the doctor said, oh, maybe from growth. No, he had always been tall. He didn't have a spurt. He didn't have anything. Like, to me, it just didn't make sense.
Well, and that's not the way stretch marks go either. And or like, where you get them, you're not like, oh, I gained weight. My back is going to, it's not how stretch marks go.
Right. Yeah. He had them. And so they were like, I don't know. They're stretch marks. When we went to Connecticut, saw the doctor for neurofeedback, and then she sent us to a functional medicine doctor. And quite honestly, she was amazing. She really was. She is the one who said he has Lyme disease. I know he has Bartonella. The protocol, we did all the testing and it came back. His IgG, all of those numbers were right aligned with a chronic case of Lyme disease. I had never seen Carson with a tick. I never noticed a tick bite. None of that is anything that I can ever say to you. Oh yeah, I remember. I don't. None of it. Like, there's not any connection there for me other than, yeah, now that I know and how he's presented and the things that he's had makes sense. So she did this protocol that started to treat. She wanted to tackle Bartonella first because she said Bart is so nasty. And that's where you're seeing Carson started having rages. He started having, the meltdowns, the oppositional behavior, this kid that had been super easy and just a really good kid was not my son anymore. Like, he would be good. And when the IVIG was working, we saw glimpses, we saw, okay, and then it would stop. And so again, people are like, well, the psychological, the mental illnesses, and I was like, no, I refuse to believe that about him. I refuse. When we went to Connecticut, the neurofeedback doctor showed us his brain pathways and where there was trauma and where there was inflammation and where there were issues. And then the functional medicine doctor tied the rest together and said, okay, here's what we have to do. So we started on the protocol, trying to work with the doctor in Cleveland also, because functional medicine can only give you supplements. The doctor in Cleveland, she's like, this is what I need. It was a nightmare because the quantity, Krista, as you know, of supplements was overwhelming. On top of let's change his diet and let's try gluten-free. We already knew he had lactose issues, so that was already being dealt with. But then gluten-free, to a child who, at this time, he's not a child anymore, but to a teenager who just wants to eat normal foods, I said, hey, we have to do this for your health. And so at that time, we really changed our diets and we started eating a lot of healthier foods, right? So instead of chicken tenders, I'd be like, Carson, I'll grill you chicken. We had a lot of fresh vegetables, a lot of fiber, which should have worked,
Right.
To help with the chronic constipation. Carson got worse. We were at such a dark place 2 years ago when we called, and I didn't know where we were going to end up because he was so bad. And I was so scared because he just was refusing everything. He wasn't eating at all. He had lost even more weight. I don't know what we would do or where we would be if we hadn't found you. You took our horrific situation, and has it been an easy path? No.
And it's not over, unfortunately.
No.
But it's better. Yeah.
But it is within the first month, you made it so, because he told me, I am not going to any more doctors, Mom.
Yeah.
I am done. We had seen so many doctors, so many doctors that dismissed things, told him he was fine. We saw therapist after therapist after therapist. The last therapist who said it was us and that I should find real doctors, not the quacks that I was seeing.
Because you hadn't tried that route, I mean, that's the thing. You guys had done everything. And I remember too, when Carson first came, like he was done with pills too. Right.
Yeah.
And one thing we tried to do is, I if I'm remembering correctly, bargaining, like, well, how many pills would you be willing to take? Like trying to find things instead of just shoving down a kid's throat. Like, no, I want you to take all this stuff. Well, if we can find a multi that has most of what we need, because you've got to take what a kid's willing to give, like it doesn't matter. Oh, well, but you guys, I mean, these stories would all have bad endings. I feel like if it weren't for moms, like moms are the heroes of most of these stories, and we need good moms and dads. Good dads too. Carson's got a good dad too, but moms are the ones that seem to find the answers. They do not give up on their kids, and
it just didn't make sense.
Yeah.
None of it made sense, even to the point of like, now do I understand, because you also found the compression syndromes, right?
Well, and that was, so that was really interesting. I was at an ILADS conference, and they're always talking about, okay, in kids, frequently you'll also see POTS and, these different things. And then they added to the list compression syndromes. Give your version to people, like parents, like what's an abdominal compression syndrome or venous compression syndrome? What's the broad definition?
So, Carson, when he would eat, I thought he was just this crazy, he didn't want to eat, and he was a normal teenager. He'd go sit on the couch. Compression syndromes, I think for somebody that develops it, now we know that Carson's probably had this, we're 99% sure he's had it his entire life, right? He's had the MALS, he has MALS, and SMAS. And what happens is the food just doesn't digest. MALS
just sits there.
Yeah, his is neurogenic. So when he ate, it would cause pain. And over time, our dinner time, we used to be like 5 or 6 o'clock by the time we got home from school and all of the things. He kept pushing back. I'm not hungry. I'm not hungry. I'm not hungry. 8 o'clock, 8:30 at night, we're trying to eat dinner, and he'd eat, but he wouldn't eat the whole day, and he'd only eat at night. Well, because you're in so much pain from eating, right? If you're eating closer to bedtime, you go to bed and you're not as aware of the pain, because your food does not digest. Nothing digests.
Right.
So the amount of supplements he was taking on top of not digesting things, right? We've seen
Right.
two doctors who confirmed everything. And he's had the surgeries now, and we're in this right now with
Right.
the surgeries, the healing part and the things that all have to happen. It makes sense. His body was not able to process right what he was doing
Mhm.
with the IVIGs. When he was getting IVIGs, Lyme is such a tricky, smart disease. At first, it was this onslaught of like, what the heck's happening? It worked for a little while. Then it didn't work, right? It didn't. All of these things now are like so connected. The allergies with MCAS,
Mhm.
understanding that he
A
has
hypermobility.
EDS,
Yes.
right?
Mhm.
Like all of this has been a journey,
Right.
such a journey. However, Krista, your determination, your constant learning, you're not shutting a door and saying,
Mhm.
it's only this, is the only reason, right? Because he was diagnosed hypermobile when he was 6 months old.
But
Nobody
nobody
ever
knew
said,
what does this mean? Because the hypermobility, that's interesting. If you think that's something people can see. So, he can do bizarre things with his joints still, right?
oh
Think
yeah,
people who are uber flexible and can do party
he's
tricks.
yeah, party
Right.
tricks.
Right. Because if you've got connective tissue that's not working, it's not just what we can see, then that's happening on the inside too. So it's not like
Motility.
the EDS and the compression syndromes and all these other things are all these separate bad things. It's kind of like one big bad thing. Like there's an umbrella with,
Yeah,
unfortunately, all these manifestations of it. But I think, part of why he's continuing to progress and still will, there's more. I mean, after you guys finish this horrific journey of finding a surgeon, getting insurance coverage, and even with insurance coverage, it's insanely expensive. Then you reached out and said, okay, I think we need to test for these infections and figure out what's still going on.
right.
Knowing
Because
for some kids, this is not a short path and there aren't shortcuts.
no, and I keep trying to remind Carson that of the progress that he's made incredible progress.
Yeah.
Is it easy?
No.
No. Are there days that he just wants to be done with it? 100%.
Yeah.
However, your approach by being like aware, what can we get him to do that he's willing to do?
Right.
Working with him and giving him some say, right? Because again, these are things that are out of his control
Right.
that feel so awful, right? Because you just want to be a normal, what you think is a normal, typical kid.
Sure.
In between, like he broke his femur, he loves to snowboard, broke his femur, got 2 stress fractures. We did all the right things.
Right.
He got 2 stress fractures in the other leg. Well, now we know the malabsorption, the hypermobility, the issues with it's all tied, like you said,
Yeah.
all tied together. Instead of being told, well, it can't be that,
Right.
you kind of were saying like, wait, we have to look at the whole. And you do that, and you don't just dismiss, this seems really weird if I tell you so, like if I say to you, this seems really weird, but here's this. You always are like, well, let me think a little out of the box, like that out of the
Yeah.
box where
Because nobody would make this crap up. I mean,
oh,
that's the thing. This whole idea that like it's the parent or the child or it's Munchausen or Munchausen by proxy or they have anxiety. Who in their right mind, if they were going to make up a story, would pick this one? Like it's too weird. Like
right,
it's too weird. Nobody chooses this. Can you talk a little bit about, so like the ongoing advocacy, even once we got the diagnosis of the compression syndromes, what you had to do to find a surgeon you felt comfortable with and treatment you felt comfortable with? Because I will say, like, it's hard. I can't be an expert on everything. And so I find things, but I had a name to give you to look at, but I don't have this like huge network of people that I work with on a daily basis who all do these surgeries all the time. Like, you really took the bull by the horns and drove this process. Can you just tell people a little bit about that journey?
Sure. So thankfully, and unfortunately, someone who has seen Dr. Schuett in California.
Yeah.
This is not an easy path. It's not. It was like, okay, we have this diagnosis.
Right.
We started with Dr. Schuett. So thank God for that name, because that is the surgeon that Carson went to. Getting there was not easy, for sure.
You live in Pennsylvania,
We're
first
in
of all, so
Pennsylvania.
geographically. Yeah.
She's in California, in Beverly Hills. He's amazing. Is it a fight? Yes, because insurance wants you to see, as we have gone through. So it's a year ago right now that you
Right.
diagnosed, you sent Carson for his scans, and we found the SMAS, right? We called Dr. Schuett right away. He did a consult with us and gave us a list, a very big list, which now I understand. He gets MCAS, he gets EDS. You have to be aware of all of those things going into the surgery. There's got to be a treatment, because the surgery is so intense. And Carson had both MALS and SMAS, but insurance wants to direct you to the closest, to somebody who might understand what they are, who one of the doctors that insurance suggested for us was dead. They gave us a list. The other doctor, even after Dr. Schuett agreed, we had to have a lot of tests for him. We had to find here closer to us a GI that would do an endoscopy, an introscopy, right? There's like a list of testing, because Dr. Schuett has to make sure, is it really a compression syndrome? Is it MALS that's driving SMAS symptoms? There's so much. I could talk for hours on all of this process. He's very, very, very comprehensive. He's really and I understand it now, and I am so incredibly thankful.
Well, that's why you want him to be the guy that does the surgery, because he is looking at
looking at the whole, right? He doesn't just say, oh yeah, I see this on your scans and let's do this. In the midst of all this, you helped us to determine Carson also has clotting issues, right? So Dr. Schuett's aware, he wants the whole picture. The surgeries are super intense. They're not easy. I mean, we're 6 months and Carson still has a feeding tube, and we're seeing him in a couple weeks. And what the path was, though, was horrific. Even with a surgeon saying 2 compressions, we went to the GI doctor, and this is where I think so many people get tripped up, because they go to a gastroenterologist should understand this. These are, or a vascular surgeon should understand.
GI should be the ones really screening, catching this. You know what I mean? Because it has all these GI manifestations. So like, early satiety, pain after eating. Boy, we had to screen you for this.
We know Carson's records from when he had his first endoscopy, and it said there was suspected malformation of his intestinal tract. They told the specialist told us everything was fine with the constipation, with the eating, going back 16 years ago.
Right.
So the GI doctor that we saw now, with the 2 diagnoses, right, said to Carson, I don't know how I held myself together. Just the thought that he needed to have this test. He needed to get an endoscopy for Dr. Schuett. The doctor said, how old are you, Carson? And Carson's like, 18. And he said, you don't want these. They're really bad. You need Miralax and an antidepressant. And I intervened immediately saying, hold on a minute. Wait, are you looking at all of
Because
the
this is
information?
diagnosed by imaging too. This isn't just a like, oh, you
I
fit the
guess.
picture. I mean, there's actual proof. Well, of course he doesn't want it. It's not like, oh, I don't. Well, I'll give it back then and try something else. Like, I mean, that's insane.
And so I think what happens to people is it's such a fight that
Yeah.
people eventually give up.
Yeah.
I couldn't give up. Like
Well, and even with the surgery, I mean, wasn't it days before you're
the
supposed
day,
to go there? The day.
the
Okay.
day we were leaving for California that day.
Yeah.
We had agreed that we would pay the out of pocket for there's fees. Insurance will only cover this. They will only cover. I mean, I probably am written down somewhere as a crazy person from the insurance company. I'm sure I'm flagged.
They may have made you that way though, but that's all right.
They are. The chief medical, I finally got, not without letters, and Krista, you wrote letters, not without calls, arguments to the chief medical officer who intervened, because I said, if my son dies from these, he's failing at life because he can't eat, because he can't process anything. We also saw another doctor in Pittsburgh who confirmed an intestinal transplant doctor. They were both on the same page. Dr. Schuad's laparoscopic, we knew with the EDS we needed to do laparoscopic was the better way,
Right.
which is why we were, and Carson felt confident. He liked both, but he felt confident with Dr. Schuad. That day we were leaving, I wire transferred money to them again in California because Dr. Schuad was amazing to work with. His team, he did peer-to-peer. He fought for us in every single way. And I have to say, so did Carson's doctor for PANDAS fight.
Yeah.
This is a path that we had been on because of all the IVIGs fighting.
Right.
We paid out of pocket for our first IVIG.
Yeah.
So it's not something that was foreign to me. I just was fed up. Like,
Right.
how dare you? Finally, our dots are connecting. And how dare you say that my son's life is not valuable enough to go to the surgeon that can treat him the right way.
And what you pointed out too, that I don't think everyone's aware of, these are life-threatening. There are unfortunately high mortality with these things.
Yes, because you eventually get to a point too where you are such a risk for surgery.
Right.
We were barely keeping Carson where he needed. Dr. Schuad said, I don't care what you can get in him.
Just calories. Yeah.
Just calories. And it's not that he didn't want to eat.
Right. Right.
He would eat and get so sick.
Right.
That he couldn't eat.
Yeah.
So, and even with eating, we saw the images where the food would go in and it wasn't going anywhere.
Right.
So yes, is he constipated? He also, we know the motility is a piece with the constipation.
Right.
We know that.
Right.
So we have a motility specialist that we also are working with. Dr. Schuad's like, we need pieces together. Like, you cannot just say, I'm going to have this surgery
and all my problems will be over.
You can't.
Yeah.
That's not how it works.
Yeah.
Now, he's had the surgery. Does he have pain from eating? No. That was unbelievable.
That's a miracle right there. Yeah.
There's an SMAS on Facebook, a group that is super helpful. Malls. There's several malls that are helpful. Malls is easy. I don't want to say it's easier. It's not easier.
But it's more straightforward than if you've got multiple and you've got the malls and the SMAS and others.
A lot of complications. It's a
so
bigger.
You would suggest, like, for other parents, some of these online support groups have been one of your better resources?
I would say
Yeah.
for sure.
Do you mind if I ask you? You don't have to answer this if you want, but I just don't want people to have the delusion, even if insurance finally kicks in, it's still a huge personal expense. Like
Oh,
this is not a insurance will finally cave and everything's 100% covered.
not at all. Not at all.
Do you mind giving an idea of this kind of cost that's involved?
Sure. So because we're in PA, we had to stay in California, and you have to be open-minded when you're staying in Dr. Shuad, he agreed to do, because of Carson's struggles, because of where he was, because of everything that we had done previous, and he knew ahead of time, he agreed to do MALS and SMAS at the same time. He does not like to, because each recovery is a lot. He agreed to do them both. We had to stay in California and be close, which I was 100% about, because I don't.
You don't want to be on the other side of the country if something goes wrong.
Yeah,
Sure.
there's not doctors who understand it. They
Right.
don't. So that cost, we had to stay. It was over $10,000. Our airfare back and forth was, I'm a wheeler dealer. I can get points here. I look at this credit card. It's not something that I think people at our stage are not familiar with the cost, right? I mean, just the testing, insurance will only cover, we're still fighting some tests because they're saying they're not medically necessary.
Right.
So there's costs for all of that. Our friends did finally, one of my friends was like, we're doing a GoFundMe, Michelle. How can you even, you've done this for so many years, right? Because again, even with PANDAS, so many things are outside of the realm of insurance. And the neurofeedback, all of these expenses over the years, when people are looking at this, it's daunting. It is so overwhelming. If I could change anything going back, I could find a starting place, I would test for Lyme the right way first.
Right.
I think that is, for so many PANDAS kids, I'm going to tell you, I think Lyme is the underlying.
Well, and I think it's why IVIG doesn't stick, because I feel like with my patients who have had IVIG and they improved, but then they failed, if the IVIG is done in tandem with the treatment, then because I've had people who've done just treatment who aren't getting there either. You know what I mean? You've got to modulate the immune system and treat the infection. And then I like what you said too, him looking at MCAS, because I'll have people come to me and say, well, I think MCAS is the thing. And I'm like, it's a thing.
It's a thing.
It's a thing and it's important, but they want so much for it to be, if I just fix the MCAS or just the compression syndrome or just get IVA, give me antibiotics, I just know I'll be better. And I'm like, I really wish it were more linear, but you've got to look at all the pieces, because all of these, your body all communicates with each other. You really don't have any problem that's just a GI problem, because your nervous system, your vascular system, they all communicate with the gut and vice versa. Like, it's really hard to just put things. And I think specialists have, they provide something wonderful, but they've really screwed up medicine too, because now we want everything in compartments now.
I agree with you 100% on that.
And if you don't fit in my compartment, you're really a psych patient. That's kind of
that's how I feel our path is.
Yeah.
That is exactly what happened to us. Like, instead of saying all of these, and unfortunately, when people look at doctors, they want insurance to cover, which I get.
Which should, but
it doesn't.
Yeah,
it doesn't.
Yeah.
And understanding, when I will never forget us trying to think, how are we going to cover functional medicine? Because insurance covered zero, neurofeedback zero.
Right.
Okay, we'll just put it on credit cards and figure it out later.
Later.
Okay, well, this is how we've kind of done things.
It's your kid's life. I
It's
mean, you
life.
don't.
I didn't
Yeah.
care.
No,
I,
no, I
I
get it.
I would sell my house, my whatever it is,
Yeah.
because it's his life. And it got so scary because the compression syndromes get worse if they're not
Right.
treated,
Right. And
right?
nothing else is going to work
Nothing. Well,
if that's not
our
treated.
treatment, right? I mean, he made huge strides with the things that you did.
But we stalled. We
We
were just
stalled. It was
stalled.
like,
Yeah.
and then the pain from the eating just got so much worse. Well, he's not getting any
Well,
nutrition.
and I think Carson's interesting too, because from what he's telling you and behavior, the pain's bad, but sometimes we don't always know how bad because he's not a dramatic kid.
Not at
But
all.
then I have people who have these things who are uber dramatic, which just then feeds into people thinking it as a psych thing. And even though they may be extremely dramatic, their symptoms are still real. It's like you can't win.
Well, and I
You
think
just can't
because we're
win.
all so different, right? Everybody has a different pain tolerant. I go back and I think I have cried. I mean, I've like
Yeah, sure.
the pain that Carson has had to learn to live with,
And to normalize. I
to
mean, it's
normalize it. He
yeah,
normalized that pain. His tolerance, which Dr. Shewitt said is, kind of watch that. Like, because
yeah.
he's got that threshold that's high,
It could be his Achilles heel because he
very
doesn't
much.
act soon enough. Yeah,
Yeah, like it's
yeah,
so an understanding for everybody that the path, right? Do I think now the people that I have interacted with in the both of the groups have multiple MCAS, EDS?
mhm.
Um,
POTS, compression syndromes, Lyme,
yeah,
Bartonella,
yeah. There's so
yeah,
many of us that are all like very. When you hear their stories, you're like, okay,
yeah, yeah.
is it a big enough group of people though that it's made a difference?
Well, and I think part of it, there's so many people who don't know.
Right.
If we were to unmask more of this, there would have to be a call to some action because moms aren't going to shut up. But your first thing has to be helping your kid. You can't change the world if your own kid's not taken care of. And that's
Right.
the hard part. So what would be, just kind of parting advice to anyone dealing with this as a patient, but especially as a parent navigating this? What do you wish someone would have told you?
Um, I I think I wish I would have questioned more early on.
Right.
Right. I wish I would have when it didn't fix a problem or it was such a lingering problem. I think there's always a why,
Mm-hmm.
an underlying something.
Yeah.
I wish I would have questioned that more at that time. A 2-year-old 2.5-year-old sitting on the toilet for 45 minutes isn't a kid who's not wanting to poop,
The fact
right?
that he's willing to sit there that long for a little
Yeah.
boy, I mean, that's
We
a
read
lot.
books, we did whatever we had to. Like I wish I would have questioned that then.
Well, it's hard though, because if you think about it, you did do the right things. You went to
Well,
doctors and you went to
yes,
specialists, and you don't even know if what
you
you
don't
needed
know what
was
you don't.
available then, and you don't know what you don't know. But
Yeah.
I think just that underlying, I feel like this is the whole point of integrative medicine. There is always a why, because like even MCAS isn't a why. MCAS is a syndrome. It's symptoms. It's still, we got to go farther back, and we don't have control over all root causes, but the farther back we can peel those layers, the better outcomes you're going to have.
Well, I always say that to Carson. I say, remember what Krista says. It's layers, Carson. We're
Yeah.
uncovering your layers. And you've made, such a difference for us.
Oh. Well,
I
you
don't.
guys, I'm so glad he has the parents he does, because it's a family journey. It's a family journey. And I, it, I, I wish every kid had a parent who would fight for them, because I've had some young adults, completely anonymous, generic form language here, who have come in, who are sure they have these infections and have all these symptoms, and then you have angry parents who are like, he just needs to take his medicine and see a psychiatrist. It's very uncomfortable for them, and so they're doing the same thing these other providers have done to you, and forcing their kids into a box and making it their
Yeah.
problem. And it just breaks my heart, because I know it's hard to get better without support, especially if you've got people working against you. So
100%, because
yeah,
then it just confirms something is wrong with
yeah,
me.
you're the problem. Yeah,
It's me. That's yeah.
you don't
And
have a problem, you are a problem.
you are,
Yeah,
yeah. And
yeah,
that's not how it should be, right? I mean,
no,
and as we're walking this journey, just keep seeing more and more people who have a similar story,
yeah,
or have a story that's, you're like, wow. So I would say, if it's important to question things,
yeah,
it's important not to take things at face value. You have uncovered so many whys for us, and didn't minimalize, this is what's happening. How do we go forward, and what's the
right.
next step? And so without that guidance, Krista, I mean, I think that for people, I tell people all the time, integrative medicine gives you more options.
It's the best of both worlds. That's why I
It
love it. It really
is.
is. It's
It is.
because there's truth everywhere. I mean, really, what all of our health and medicine should be just about finding truth. And if we find it in the quote unquote natural world, or the quote unquote traditional it doesn't matter. If it's truth and it helps, then we're going to embrace it. If it's garbage, then push it away. But I really appreciate you coming on, and we appreciate Carson being willing to let his mom come on and to talk to him,
He
because
said, Mom, I don't have to talk, right?
oh, no, I knew Carson would not be interested in this gig. If he ever
No.
is, have him let me know. But I was pretty sure this was a
Yeah.
mom conversation.
Yes, yes.
It would have been a lot shorter if it would have been Carson or his dad
Right.
providing the data. But that's okay. We all have different roles. But thank you for sharing. And remember
Thank
Michelle and
you.
Carson and their journey, and to have hope. And I also promised that I'd give a shout out to my son Gideon and tell you this episode is sponsored by him, because he let me borrow his headphones when I left my network again. So thank you, Gideon. And remember to have hope, because you were made to be whole.
Thank you.
Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.